Well, I think, oops, no, just as I was about to speak, I was going to say, I think we're maxing out. I think we're probably in and around the number now. So rather than keeping people waiting, because I appreciate your time is valuable, I'll start today's session. So, firstly, my name is Craig Dickinson. I'm the Head of Sales and National Partnerships here at British Friendly. And today's webinar, we're going to talk about today's workforce flexibly covered. In brief, the summary is we're going to talk about some of the changes we've made very recently to our Protect proposition and how this works practically in the market. I'm also joined today by Debbie Cullen and Dr. Emma Southworth from HealthHero, who you will hear a little bit more from later on with some exciting enhancements we're making to our already award-winning value-added services. During the session, if you've got any questions that you'd like to pose or some thoughts, please, if you can, put these in the chat function. My colleague Olivia Robinson will be managing that function for us, and we'll try her best to answer the questions as they come through. And if we have time at the end, and I don't waffle too much, which is distinctly possible, we'll try and pick a few questions out at random. And if we can't answer any questions today, then obviously we'll come back to you with a response at a later date. Please also note that today's session is being recorded, and we will issue out a copy of this recording along with the CPD certificates once we've finished the session. Right, let's get into it. So, as I said, thank you very much for joining us. We're really excited to share with you what we've been working on. Today's workforce has changed massively over the last few years, but protection hasn't always kept up. We're aiming to move away from stereotypes to focus on the actual lives your clients are leading, whether they are corporate directors, frontline NHS staff. Today is all about showing you how our new Protect flexes to fit whatever your client's job, income or budget may be. With this in mind, we've kept today's session very practical to make sure it's a good use of your time, and as I said, time is valuable, and also counts towards your CPD. We have three main objectives. Firstly, helping you spot new opportunities with the clients in today's workforce. Second, showing you how to use our new technical tools to build better cover. And finally, looking at how our new health services add value from day one. Now, aside from this, I have my own personal objective, and that is, at the end of this session, your perception of British Friendly will have changed. Now, previously, you may have been forgiven for thinking that British Friendly is a niche income protection provider. Good for cases where it's a little bit trickier, maybe a harder to insure occupation that the mainstream providers won't look to offer. Maybe even putting us in a box with other niche providers of the type. And if anybody that knows me well,
You've gone on.
I'm muted myself at the same time. Well done, mate. And for anybody that knows me well, I don't like to be put in boxes, and therefore we've been doing a lot of soul searching to try and get out of these boxes. And in fact, when I first joined British Friendly 3 years ago, I was talking to an old IFA friend of mine, and when I said where I was joining, his first response was, British Friendly, age costed, smoking builders. And that made me think. I was like, I'm pretty sure that's not the case. And having to reflect on this and thinking about it, knowing that we cover over 2,300 occupations, from admin assistant to zookeeper, and offer a wide range of level benefits alongside our age costed benefits, it made me think, is that truly the perception of what British Friendly is? And what can we do to try and change it? And I hope that by the end of today's session, once I've explained some of the changes that we've introduced, that you'll start to think outside of that and help me climb out of that box that we unfortunately seem to get put into from time to time.
I think you're on mute again, Craig.
Not going technically very well today. Let's see. There we go. So more than just a niche income protection provider. So we've done a lot of listening over the last year, and our purpose is simple. We've enhanced our protect to ensure our cover is more suitable for a wider range of modern lifestyles. Whatever your client's occupation, income or budget may be, the changes we've introduced are designed to help you and help your clients. So firstly, we've increased our maximum benefit from £4,750 per month to £10,000 per month. Now, to put that into some context, according to ONS, and I've done some research on this, the average salary in the UK is around £39,000 a year, probably 47,500 in London plus, apparently. However, there are 3 million payrolled employees, that's 10% of the payrolled employee workforce, that earn over £5,000 per month. Now, previously, you wouldn't have been able to place that business with us because of the limits, the self-imposed limits that we had. However, now, that 3 million, you can place them all with us if you like, I wouldn't be upset, can now be covered under our new maximum benefit. To support this, we've increased our replacement ratio to cover 65% of the first 60,000 and 50% thereafter, meaning you can now secure an annual benefit amount of up to £120,000 per year. Now, alongside this, we've also introduced, a 104-week deferred period. This is specifically for your clients with long-term sick pay, and we've brought in reviewable premiums to help cover your clients with smaller budgets, and that's alongside our guaranteed benefits also, to make that clear. Also, as I mentioned earlier, our award-winning, and I'll say again, award-winning value-add services have also been enhanced to offer even better value to existing and new customers, with the addition of 2 new extra services at no extra cost. And I won't steal Emma and Debbie's thunder on this one. They'll talk a lot more about this later on. So let's look at the details behind these changes and how we've enhanced Protect to help cover more of your clients. So as you can see from the screen, we offer 2 premium types, level premiums or age costed. Now, sitting underneath that, you have the option of either guaranteed or reviewable premiums on both level and age costed now. You also have the new maximum benefit amount of £10,000 per month. That's £120,000 per year. Obviously, with the replacement ratio, as I mentioned in the previous slide. Also, across both types, you can have a short-term claim period of 1, 2, or 5 years, or until the policy end age, which would be deemed long-term. The 1, 2, and 5 year short-term can be a very good cost-effective way of getting people IP if they're budget conscious. You can also have a level cover, or you can increase it with RPI. We offer a wide range of deferred periods across both. On our level premiums, you can have the standard 4, 8, 13, 26 or 52-week deferred periods. And now you can also have the new edition of our 104-week deferred period. On our age costed premiums, you can have all of them, but also the addition of day 1 deferred period and 1 week deferred period. However, day 1 is only available on long-term age costed only. So, finding the right fit for their budget. Now, value and budget are probably the 2 most heard objections when recommending protection or IP. Well, other than the old chestnut of it'll never happen to me, or the bank of mum and dad. That's always a favourite of mine. And it's very tricky to explain value to someone for something that isn't tangible. And according to the CI Expert Critical Thinking Report, a lot of the responders to their survey about value and protection propositions and critical illness, income protection, they didn't see a value, or they couldn't understand the value, nor in some instances, and I urge you to go and find a copy of the report and have a read of it, because it's very interesting. They didn't understand the differences between income protection or critical illness, or what they actually covered, which is quite frightening, to be fair. So with that in mind, we've tried to make it as straightforward as possible, giving options across Protect to make it more affordable. So if your customers are looking for certainty and knowing exactly what's going out of their bank account for the long term, then choosing our guarantee premiums would be a good option. However, if they need to keep it a little bit more affordable right now, our reviewable options are a great alternative. Whether they choose level or age costed, we can guarantee their premium won't change for the first 5 years, giving them valuable protection that fits their current budget. So now we've talked about the detail, let's look at it in a practical sense. Let's have a look at Sarah. Sarah's an employed office worker. She's very fortunate. She has full employer sick pay for 2 years. Thinks because of this, she doesn't really need IP, because she's got really good sick pay with her employer. However, the question should be, what happens after 2 years? So if she gets a long-term illness that continues over that two-year period, how then does she support her lifestyle, support her family's lifestyle, pay for the important bills, possibly even medical bills that may come along with the illness that they have? By using our 104-week deferred period, you're no longer competing with the employer's support, but you're completing a long-term financial plan. This allows you to offer Sarah a solution that bridges the gap when her sick pay ends, providing a highly cost-effective way to ensure that she remains protected well and truly into the future and supporting her lifestyle. Now, Anya will probably be very familiar to a lot of your customers that you may have. She's a first-time buyer. She's saved really hard. She's gone out there and she's saved all her pennies to make sure that she can get the deposit together and all the other ancillary costs that come along with moving house. She's stretched herself and is massively worried about any extra monthly cost, and therefore signing up to any protection policy, let alone income protection. Now, we all probably know Anya. There's probably an Anya that we've spoken to, and trying to convince them that they need that cover is very, very difficult. However, by introducing the reviewable premiums on our level and age costed, we've given you a way to offer a price at outset that makes her feel much more comfortable from day one, making that buying a little bit less daunting. And to help take worry of future costs, we've also guaranteed the premium for the first 5 years. It means that you can offer your clients 5 years of budget certainty. And this effectively ensures Anya is protected and that she can stay in the home she's saved so hard to buy, should she have to go off and be on sick for a long period of time, or even a short period of time. Finally, we're going to have a look at Ali. Now, as I mentioned earlier, Ali is in the 10% of payrolled employees. He's a corporate director, earning £110,000 per year. However, as we all know, the more you earn, the more you spend. You live within your means. He has high monthly outgoings. And under our old limit, of 4,750 per month, he would have had a shortfall in what his actual needs are. So by considering a client like Ali, he requires a safety net that generally reflects his standard of living. By increasing our maximum benefit to £10,000 per month, we have ensured there's ample capacity to provide the level of cover that clients like Ali need. Now, under the old limits, Ali, as I said, could have secured a benefit of £57,000 per year. Under our new limits, he can now get £64,000 per year. That's an extra £7,000 a year, which will allow him that buffer and allow him to pay his expenses that he probably has and leave him with less of a shortfall and make sure that his family is still him and his family are still protected. Now, there are probably, like I said, there's 3 million of not necessarily Ali's out there, but there are 3 million people in that higher bracket who are earning over the £5,000 per year, £5,000 per month benefit limit. So, I've talked a bit there about the technical side, but now I want to talk about the really important human side of our income protection. We want our members to have the support that they can feel from day one, which is why we've partnered with HealthHero. My HealthHero is more accessible than ever. Whether your client prefers using an app or a web-based browser, they can get professional help in minutes. Now, many of these services can be shared with your partner and children who are under 23 or in full-time education and living at your address. To explain exactly how these work in practice, I'm going to hand over shortly to Debbie and Dr. Emma, who will cover off our new changes that we've made. So our 2 new services that we're adding, as I said, to our award-winning value-added services, 2 new services, and also give you a bit of a flavour and a feel for some of the other things that are already available within our proposition currently. So over to you, 2 wonderful people.
Thank you. So before I go into women's health, what I'm going to do this time is, just in case people aren't familiar with the virtual GP service and what that provides people, I'm going to start there. So the virtual GP service, so we've been doing virtual GP work now for almost 30 years, believe it or not. And what we're offering is video and telephone appointments. Patients can book 7 days a week, 365 days of the year. And broadly, it is used for what we describe as episodic healthcare as opposed to continuity care. So the difference meaning episodic care is more in the moment, I've got this thing today, how can you help me with this? Whereas continuity care might be, I've got diabetes, I need to have regular checks and my medication tweaked with my continuity care doctor, which would probably be your GP. So we are primarily episodic. So the kind of things patients call us about, I mean, it could literally be anything, but it is often that acute episodic illness. So it's very often going to be flu and coughs and colds and ears and skin infections and aches and pains. They might have run out of their usual medication and need a bridging prescription while they wait to get hold of their NHS doctor. They might have had a diagnosis of a health condition that they just want to have a few more minutes of really digging into to understand it with someone. They might have had a test result. So it might be that they can see a test result on their NHS app or wherever it might be, but they can't get a GP appointment for a couple of weeks. And so they want to discuss that result with someone quicker. They might be asking whether they need to even see a doctor. Is the thing that they've got worrying or is it not worrying? What are their options? How to navigate the NHS? Because sometimes we can just talk people through, actually, these are the ways to get best care for what you have through the NHS. We get a lot of mental health, mainly stress and depression, I would say, a lot of work-related stress. And we get a lot of queries about ADHD assessments as well. But really, pretty much you can call about anything you want. It's just to be aware that it is more episodic than continuity. And then just briefly touching on what is not covered. So, as I said, we try not to mess with continuity care because the NHS GP, of which we are all NHS GPs as well, they won't want us messing with that. We might be able to have some thoughts that we give the patient, but we don't want to mess things up. But we can give advice, we can give second opinions, but what we do not cover is emergency care. So if, for example, someone was having a heart attack or couldn't breathe, we would definitely be the wrong person to call. Or if they were severely unwell. We don't get many people trying to call us with those things, to be honest. And if a patient was having active suicidal thoughts, we would also post them to NHS services. We issue private prescriptions rather than NHS prescriptions, but most medication that we prescribe is actually a very similar cost to a standard NHS prescription. There are a few outliers which cost hundreds of pounds, but most of us are familiar with those and we wouldn't be prescribing them in general. And then once the patient has had their consultation with us, we send them a text on their phone, which has a code. They take that code down to any pharmacy they want, any pharmacy in the UK, and they can pick up their prescription with that code and their date of birth, and that's it. And there's also a home delivery service that the pharmacy that we work with generally does next day delivery. So if someone doesn't want to go to their pharmacy, they want to stay at home, that's also possible. What I'm actually supposed to be telling you about is the fact that you're adding on women's health to what you already have. So you already have the virtual GP service, and in the last couple of weeks, women's health has been added on. So we have been doing women's health for just over a year now, and it's been received very positively from the clients that are accessing it. It's a very simple concept where we are basically matching GPs with certain interests with patients who have that condition. So we've selected a cohort of our GPs who have had additional either interest or training or skills in women's health. They are not gynecologists, they are still GPs, but depending on how familiar you are with GP training, we all start off at different places and come through different pathways to become GPs. So I didn't start off as a GP, I started off as a hospital doctor, and then I diverted into general practice. Some of them will have done ear, nose and throat and then diverted into becoming a GP. Some of them will have gone straight into general practice, but there's a massive variety. And then once we're in our career, we tend to do more of one thing than another, either because that's the kind of patient we attract or the kind of interest that we have. So when you book a GP appointment as a patient, it is a bit of a pick and mix as to who you're going to see and what their interest actually is, which generally is not a problem and works fine. For the majority of stuff, we're all absolutely fine. But if you had an ideal world, it would be nice to see a GP who had a special interest in what you had, and particularly with women's health, where we know there can be quite a deficit in training. So what we do is we provide appointments that are very slightly longer, and your patients have unlimited access to those appointments. And then we haven't narrowed down the scope, so they can come to us with any women's health problem. It doesn't have to be, for example, just menopause or HRT. It can be anything to do with women's health. The way they access it is that when they come through the app to book their GP appointment, there are also some little tiles that give them other options. And one of those options will be women's health. And if they go into the women's health box, they can book an appointment with one of the women's health GPs. So what does women's health include? It could be literally anything that woman deems to be appropriate. It really, we have no exclusions really on this one. So it could be periods, it could be breast health, PMS, bone density issues, menopause, contraception, HRT, prolapses, infertility, pregnancy, miscarriages, urinary symptoms. The list goes on. And I sometimes have men who have booked in on this service entirely reasonably to talk about fertility. So actually it is a kind of, or they may book in an appointment with their wife having another appointment. So it isn't always women. And they will be offered an appointment with a women's health GP, as I said, and it's generally available the same day or the following day. If there is a scenario where they come through and actually they can't get an appointment till tomorrow and they want one today, they can still get an appointment with a regular GP. So they don't have to wait. It's just a choice. We can then provide relevant medications. We can signpost patients to what might be their most appropriate next step, which might be that we think they should have a scan, or it might be that they should have a blood test, and we might give them some advice. What we would never do is tell their GP what to do, but we would have a chat and we would discuss what we felt might be next best steps. And sometimes it's just a question of having a chat about how to get the most out of your NHS GP appointment. So what to say, what things to highlight to your GP to make it make them hear the most relevant points of your story. Or as I said earlier, it can be just about navigating the NHS systems. We also sometimes interpret blood tests. So some patients will have had hormone tests or pelvic ultrasounds, and they'll bring them to us and we can talk those through. So that is the Women's Health Service. The dietitian service is the other new service that is being added on to your virtual GP offering. And this entitles your patients to up to 6 30-minute sessions with a dietitian. And these appointments are usually by video, although they can do it by phone. And the dietitian team can consult about, again, a wide range of different things, really around improving or optimizing your diet in order to help either just your general health, or it might be that you have a long-term health condition or situation that could be improved by dietary changes. So there are some very specific examples. So for example, you might have celiac disease and really want to talk to someone about what that means and what you can and can't do and how you can get around it. You might have IBS, which can certainly for lots of people be improved with dietary modifications. And then there are lots of other things. So women's health conditions, fertility, pregnancy, dietary advice, food intolerances, long list of things that can be covered here. The dietitian team don't consult with patients who are under the age of 5, and they do have a small number of exclusions for more serious eating related conditions that are felt to be better managed in person or sometimes within an extended NHS team. So that's dietitians. And I was going to just touch on the SMO service, which is another thing that your customers would have access to. So SMO, which stands for Second Medical Opinion. So what this is if a patient has had a diagnosis, so they've been to see a consultant, they've had all the tests, they've been given a diagnosis, it's usually for these cases, it's usually quite a serious diagnosis. And they've been given a treatment plan, and the patient is either concerned that they're not confident that the plan they've been given is definitely the right thing, or they're not confident that the diagnosis was correct, or let's say it's a cancer diagnosis and they've been told there's nothing more that can be done. They're not confident that that's definitely the case. What this service does is it allows patients to go and see a consultant who is in the same area of expertise that they've already seen someone else in, who will be given access to all of the tests that patient has had and review their case in detail and consult with the patient as necessary, and then come up with either a report or a consultation where they will talk the patient through actually what they think. And in some cases, I would imagine it's just going to be that they agree with the first opinion, but the patient might have just a little bit more time with someone else to get their head around it. There is a list of diagnoses that tend to be the kind of things that come through to us on the SMO service. As I said, they're usually more serious diagnoses, so loss of a limb or a cancer diagnosis or loss of eyesight or profound medical diagnoses, neurological conditions where patients probably justifiably really feel like they want that bit of extra reassurance or input. So these patients book in with one of our SMO GPs. They have a slightly longer consultation again to talk through the situation, and then they decide whether an SMO is appropriate or isn't appropriate, because sometimes it isn't. So sometimes it isn't because actually it turns out they haven't seen a consultant and they haven't actually had a diagnosis yet. Sometimes it isn't because actually the story is so clearly not appropriate to spend extra time collecting data. So it depends what we find in that consultation, but it's a great service to have as an option. Now, Debbie is going to prompt me about other things that I need to mention that I may have forgotten. Or Debbie, you're better at talking about the mental health service.
Mental health. Yeah, I'm happy to jump in here. So the mental health service is an option that can be booked through the platform. What we do through the mental health is we have almost 100 counsellors, all directly employed by HealthHero. We support a vast number of organisations with what we call early intervention, kind of mild to moderate mental health issues. So what we're looking here is to set clear expectations that, as Emma said, where there may be a medical issue, maybe suicidal ideation and so on, it doesn't stop people calling us, but we will very quickly signpost to the right resource. Our intervention is to help people on that more kind of where a 6-session referral will be appropriate, help them deal with more day-to-day issues, maybe kind of make some life decisions, maybe work through some difficult kind of issues that are resulting in anxiety, symptoms of depression, managing stress, looking at coping strategies and so on. So many of us are kind of taking on additional responsibility in life as carers and changes and so on. So the mental health service, if you're not sure if or how we are the right support, book the appointment, have the consultation or the assessment with a counsellor, and they will guide. If we are the right intervention, we will support and refer. If we are not the right intervention, we'll support and signpost. So again, you waste nothing other than a bit of time to have that conversation. A couple of other things that I wanted to touch on. There are a couple of self-pay options. We've got Health MOT, which is a blood test through a partner provider, Randox. Of course, people can go to Randox, but we've actually got a very slight price improvement in agreement with them. So to do that blood test through our platform is one option. Also, we've mentioned earlier about physio and dietitian being up to 6 consultations per annum. That means that if you go beyond that, we have an option then to fund, if you want to, you can pay for additional sessions yourself. So again, it's just if that continuity is really adding value, people can pay for additional services through the dietitian after the first 6 have been used. So I shall stop there and we can take any questions that may be coming through.
Thank you very much, Debbie and Dr. Emma. I'll have to stop calling you Dr. Emma. I'm going to have to just call you Emma, aren't I, to be fair.
That's fine, yeah.
I hope you will all agree that our service already previously that in my HealthHero was already outstanding, and as I've already mentioned once or twice, award-winning. But by adding the 2 new services that we're adding, I think just makes it even better. And again, them 2 extra services are at no cost to the customer. So yeah, a very, very, very well rounded proposition. So we'll sort questions out at the end. I'm sure there probably will be a few for you anyway, to be fair, but we'll do that later on. So before we wrap up today, I want to show you the new home. We've been doing some work on our website. Now, this part of the presentation has filled me with absolute dread and fear out of everything so far, just because there's a link and I have to click on it and hope that it's going to go where it needs to. So with that in mind, I've preempted something going wrong. So I'm just going to stop sharing for a second, then reshare the website as it is. Spare me 1 second. And I believe it should be coming up on your screen now. So this is our new website with some updated graphics, makes it look a lot simpler, a lot cleaner and a lot nicer. Now, we've tried to make things easier to find for people. There's a little bit of history about stuff, and then there's information here about our proposition, so our protect proposition I've mentioned previously, and also our breathing space proposition, which is also an option. If you click along the tabs at the top, you've got, again, you can go into more detail about protect, which gives you all of the limits that I've talked about today, all of the options that you have regarding payment premiums, and also talks a little bit about additional policies that you can add on. So I'll click back over, and when I get into the optional benefits, now you can add fracture cover to your income protection policy. And also you can also add now children's critical illness. Now it's a big thing for me. It's a big bee in my bonnet that I've been rattling on about to anybody that'll listen to me for quite some time now. So for the measly amount of £3.50 per month, which is probably less than any posh coffee you can get from one of these bespoke coffee houses, you can now add £25,000 of children's critical illness cover to your plan. The silence itself, when I say it, it deafens me, to be fair. £3.50 for £25,000 worth of cover. It's a full critical illness plan and it covers every child in your household. I would hope that when you go away from this meeting today, apart from all of the other wonderful, lovely things I've spoken about and our additional benefits, our award-winning services that we've added, children's critical illness, please have a think about that the next time you start looking into income protection. Even according to my old friend Paul Roberts, at CI Expert, he thinks children's critical illness, first of all, should be placed on an IP policy. Also on the website, we've got a nice advisor toolkit. There are lots of support on here to help throughout the entire IP conversation. So that could be either registering with us if you've not got an agency already. We've got some wonderful information on our claims stats and how to make a claim and what is a claim. And this little statistic here always makes me happy. Over the last 21 years, on average, we've paid out 94% of claims. If we go back, there are lots of other support information that you've got there. Like I say, there is information about what income protection is, what's your plan B, children's critical illness, its own little section. Have a read, understand what it does and what it can do for your clients. And then we've got a nice little section on underwriting. Talks about eligibility, residency, gives you all of our pre-sale numbers. And I will say, use our pre-sale if you've got any questions about specific occupations or types of medical conditions that your customers may have, and you want to get an opinion from an expert. Our pre-sales underwriting line is managed by expert underwriters, experienced expert underwriters. We don't use chatbots or anything of that type. It will be a proper person you will speak to and will give you a valuable, experienced opinion on the information that you give. There are also many other tools on here around our BMI guide. I mentioned earlier about having 2,314 occupations we can consider cover for. They're all listed within our occupation guide, alongside occupations, unfortunately, that we can't cover. And then the section that Debbie and Emma would be more interested in are value-added services. All the details you need to know about our My HealthHero application or app that we have, or service that we have available, are all there on this session, on this section of the website. And also some information about our discretionary benefit, BF Care. You can also quote and apply should you feel fit. There's also a members section to this as well. So once you've actually sold a policy to one of your customers, they become a member. They also get their own access to this as well, which gives them the opportunity to, one, look into what they've got, be able to make a claim, to look through the value-added services that's there, and also they can contact us should they have any further questions. Now, I'm going to stop sharing and go back to my presentation, if I can find it. And there we go. So, with that in mind, Olivia, our questionnaire person, do we have any questions that we'd like to put into the mix today? I mean, we've got a little bit of time, not much time, but we've got a little bit of time to maybe pick a few questions out that we can ask the experts.
We have actually been busy whilst you've been presenting away. We've had a few questions in that Emma and Debbie have been great answering as they've gone. I'm happy to read them out just for the benefit of everybody else. Good question in came about the dietitian services. The 30-minute, well, the 6 30-minute sessions, is that every year or just per the policy? And we confirmed, yes, correct. That is six 30-minute sessions per year, not per policy. Another question came in regarding the women's health side of things would also be available for policyholders looking to transition medically, which Emma answered that absolutely for a consultation, but then I think probably it would have to go over to the GP services for the prescription of the hormones. And then a bit on the health check. The price of the health check is £75. I will put a guide to all of this in the chat box so you all have access to it.
yeah, we've been pretty much answering away as you've been going. Unless there are any more questions that anybody wants to kind of add in now, whilst we have a bit of time and we have everybody on the call, we're happy to take some. I think a good question came up in the earlier meeting about the extra benefits being available to people within the household. It's not just necessarily the policy holder. Debbie, I don't know if you want to kind of cover that off, the question of whether it can just be the policy holder that has access to all the additional benefits, or whether it is everybody else within that household.
I think that's a British friendly kind of guide in terms of what's on the policy. Yeah, if so, my view, if you're a policy holder and you've paid for yourself, you have access. If you haven't covered your family, then they wouldn't have access. So it has to be what's covered in your policy. So again, that's a British friendly guide as to you know, what exactly is covered within that policy. Otherwise, we'd be opening up the door to sisters, mums, daughters, wives, and you know, partners all the way through. So again, needs to be guided by British friendly.
Yeah, I think you can. I think on the system, if you put the guide on, Livy, when we've finished, if you put that in the chat, I believe from speaking to the proposition director earlier that you can nominate members of your family, so you can add them in. So when you sign up to so the policyholder would sign up to the My HealthHero app or on the web browser. They can sign up to it as there, and then they can nominate people for services. So within their household. So if it's your partner, wife, children under the age of 23 in full-time education are living in there, I think they can be nominated at that point. But the guide that Livy will put in the chat function after we finish the meeting will explain exactly what that is. Yeah,
correct. It's really easy to do. We as staff have access to it, and you just add a dependent on the app. As Craig said, your children, if they're in full-time education up until the age of 23, can be added, spouse, partner, etc. So it was a good question that came up last time. That's well worth. I think it's a great additional benefit. It's well worth talking about with clients, especially if they have young family members within their households. Another question's come up. How much of value-added service? How much is, I'm guessing, fracture cover? That is £4 per month, a flat fee with us, if I am reading that correctly. Another question, can the children's kick be added on at any point in the policy term? Can the children's kick be added at quote stage, i.e. through iPipeline, or is it done by the... So yeah, children's kick can be added on at any stage throughout the policy term. We don't automatically include our kick because we don't feel that obviously people should be paying for cover that they don't necessarily need. And yes, it can be added on throughout the policy term. As soon as somebody becomes a parent, legal guardian, step parent, if they let us know within 6 months of that event happening, they can absolutely add that on during the lifespan of their policy.
Excellent.
And then we are up to time. Any additional questions that come in, you can keep popping them in because I will keep monitoring it, and I will put that guide in there. So please fire any questions away, but I'm conscious of time, etc.
I've just added one comment there because obviously ages of dependence that varies depending upon what service you've got. So the GP service, you know, again, talk about any issue, any age of the dependent. For physio and dietitian, it's from age 5 upwards because clearly paediatric kind of care requires a specialism. And for mental health, we're an adult service. So when we're looking at dependents, we're looking at spouse, partner and adult children, usually in education between 16 to 23. That's our standard kind of awareness in terms of dependence.
Brilliant. And that should be covered on the guide that Livy will put in the chat. So with that in mind, I hope you found today's session useful. And in recap, we've added some great additions and changed some of our policy to make it more usable in today's working market. I hope also that my own personal objective, which was set earlier in the session, which was changing the perception of British Friendly, today's session has gone a little bit towards doing that. And I will continue banging that drum for as long as I possibly can. Again, I would like to thank you for your time today. We'll send out CPD and recording of the session when we've completed everything. So thank you very much and goodbye.
Thank you all.